Very much. Well, first I'd just like to say thank you so much for inviting me. It's a real pleasure to be here and exciting to be in a room with so many newsmakers that are really shaping discourse and public opinion on a lot of these topics. I'm going to be talking today about climate change and health impacts, starting broad and then zooming into my specialty, which is air quality. My own training is in atmospheric and oceanic sciences. I got my PhD at Princeton working with the NOAA Geophysical Fluid Dynamics Laboratory, which is a real hub for climate modeling. So ever since I started graduate school, I've been connected with climate change issues and how both data analysis and computers can be used to parse out different issues in terms of climate impacts and also evaluating what-if scenarios about different solutions. So when we think about the health impacts of climate change, it really runs the gamut. It's very difficult to think about any aspect of human health or well-being that is not in some way connected with the weather. And we've already heard water quality, flooding, food availability. These are all issues that affect human health. So we can't really say that human health is a standalone issue separate from infrastructure, water, and food. But there are additional layers of health impacts of climate change that are multifaceted and perhaps unexpected. One great resource is the Center for Disease Control, the CDC, came out with a report in 2013, and a few of my plots today will be taken from that report, so I put the URL here. And one of the things that they did in this report was to try to parse out what specific weather conditions can be attributable to death in the United States. Now this is a tricky business because if someone dies on a hot day, would they have died anyway? Or did they die because of the heat? And so these estimates here really should be considered a lower bound. These are the deaths that can be really directly attributed to heat or directly attributed to a hurricane. And you can see looking across this that heat is the #1 weather-related cause of death in the United States, with hurricanes coming in a close second, flooding, tornadoes, winds, lightning, and winter storms and cold coming in third. So one issue here is to keep in mind that yes, weather at its cold extreme and at its hot extreme both have negative impacts, but from a mortality perspective here in the US, the heat is public enemy #1. Although we don't know exactly what causes people to die on hot days, the comment was made by our previous speaker that, we all feel kind of irritable and grumpy on hot days. Our bodies are more stressed, and there's a lot of research going into exactly how are they stressed, but the number of heart attacks increases, respiratory disease increases, stroke increases, a wide range of health impacts go up. And even when we can't point the finger exactly whether it was heat that pulled the trigger, we can look at data like this for very extreme events and see undeniable relationships between heat patterns and death. And what we're seeing here is data from Chicago for July 1995. Many of you remember I grew up in Chicago, and that was a really record-breaking heat event here. It got national news. And what you see in the black line is the daily maximum temperature for that month in 1995 here in Chicago. And in the red, you see the number of people who died in Chicago in that same month. And you can eyeball it. It sure looks like temperature goes up, and a few days later we get a maximum number of people dying. But we can also compare that with what about every other July? And the yellow line shows that in general, of course, people die in Chicago, about 150 deaths per day. And we have warm temperatures in Chicago. That's the blue line in July, coming in at about 83 degrees Fahrenheit. But that on that one summer when we really had a spike, we also had a spike in the number of deaths. And we see similar patterns during the 2003 heat wave in Europe, and we can see similar patterns in a lot of different situations. Typically, epidemiologists have to parse out these relationships with fancy statistical tools, but when we really have a uniquely bad situation, even us non-experts can see the trends. In terms of the news, extreme heat, extreme weather, extreme flooding, rain precipitation. These are newsworthy events. This is weather. And through the morning, a number of our speakers have made this discussion about climate versus weather. And just to sort of make sure that we're all on the same page, really what climate is the long-term average of the weather. So if you have a warmer climate, you will have more heat waves. The one way to think about it is rolling a dice. If you have an even dice, you're going to roll. Sometimes you're going to get a 6, sometimes you'll get a 2, sometimes you'll get 7. But if you have a weighted dice, then it's going to just be more often that you get the high events. And another metaphor that I often use in teaching is comparing it with the stock market. Because when the stock market is going up, that's the overall trend. That's the change in the climate. And of course, on any one day, the Dow may be up or the Dow may be down. But when we have more and more days when the Dow is up, then that's characteristic of an upward trend in the stock market. And when there's more and more days when the Dow is down, that's characteristic of a cooler climate. So we can't say, oh, the Dow is up, the economy's turned around, or the Dow is down, But we can say that these events are characteristic of what you would expect from a larger pattern. And so here in LA, this is from Tuesday, noting that really there's record-breaking temperatures going on across LA. That's been getting a lot of attention just this week. Is this because of climate change? You can't point the finger, but this is exactly what one would expect from warmer patterns associated with climate change. This is another result from that CDC study, but just tying back to Chicago, if we think about the number of heat-related deaths per year, we can look at what's already been happening, and we can already make some if-then connections, but we can use these projecting into the future under scenarios consistent with what Don mentioned about sort of a better case scenario, these lower emission scenario, and the worst case scenario, the higher emission scenario. And we see that really the increase in the number of heat-related deaths, even by mid-century, is expected to go up by a factor of 5 or so. When we're thinking about this relationship between extreme events and the mean, one graph that I use in teaching is thinking about this bell-shaped curve. And keeping in mind that in any conditions, we're going to have some hot days, some cooler days, some days in the middle. But as we shift the mean, then there's going to be some days that are hotter than what was ever expected. And the days that used to be unusually hot are now going to become more run-of-the-mill. I had a really productive discussion a number of years ago with Bill Blakemore from ABC, who had visited the University of Wisconsin. And we were out at dinner, and Bill Blakemore said, it really bothers me how scientists continually say for any event that we can't say that it's whether it is or isn't due to climate change. And I was at the table. There were a number of other colleagues of mine who are climate scientists, and we looked at him and we said, but you can't point the finger that a particular event is due to climate change. And he said, of course you can't, but a news story isn't the time to be giving a statistics lesson. The truth is that these events are consistent with what science says we should expect, and now we're seeing them. And making this point that these extreme events, that orange tail of the distribution, is exactly what we would expect from these large-scale shifts in the climate, like Don outlined earlier today. These extreme events are not just related to heat, of course. We're seeing events pop up across the United States. This is a plot from the National Resource Defense Council for 2011, but a nice illustration of here was just 1 year, and the number of times that our record rainfall are shown in light blue, record snowfall shown in medium blue, record temperature in red, and then we have wildfires, droughts, and flooding that are often accompanying this. But this idea that this continual record breaking is consistent with what we would expect from the long-term trends that that have been predicted. And by the way, the National Climate Assessment that Don showed some of the results from is a fantastic report with a lot of very compelling graphics that are also, I think, well suited for public communication. Anytime you have extreme heat or any other extreme weather, it's not just the heat, it's not just the rainfall. There's other environmental impacts and health relevant impacts that go along with it. And this was just taken from the Los Angeles Times yesterday. Add to the heat, lightning, heavy rain as additional health impacts. And what I'm showing on the right is taken from the EPA, a great website that I like called Air Now, that shows what the air is doing now. And you can zoom in on your region of interest. And what I zoomed in here was for Los Angeles, looking at September this month. And what you see here are each of those little boxes is a day in September this month in Los Angeles. And the yellow is showing ozone that's considered medium, not great, not bad. The orange is unhealthy for sensitive groups, and that shows that it's a violation of the health-based standards of the EPA. And the red is just plain old unhealthy. So we can see that over this heat wave that we've been having in Los Angeles, it's been accompanied, as expected, by also unhealthy levels of ozone, which sort of brings me into my next focus of this talk, which is understanding this impact between climate change and air quality, because the air we breathe is a major determinant of public health. Nearly 10% of Americans suffer from asthma, and there's been very clear links between days that have high ozone, days that have high particulate matter, and the days that people are dying or checking into the hospital for emergency room visits. And although there's a lot of different air pollutants that we could try to keep track of, public enemy number 1 and 2 are really ozone and particulate matter. These are large-scale pollutants across the US that have widespread areas of what's called by the EPA non-attainment, meaning that they're failing the EPA standards, and that these are both pollutants that tend to cook up in the atmosphere from a variety of different sources, both transportation, electricity, agriculture, and other sources. And in fact, if you think about what a hot day looks like, it's often a bit hot, smoggy day. And in fact, I'm showing here the cover from Nature for an article that I helped write a couple of years ago on the climate change, health impacts of climate change. And the picture we chose was smoggy Chicago back in 1995. This issue about air pollution problems getting worse from climate change is something that is an active area of research. It's an area that I do a lot of work myself in. And we see that both ozone and particulate matter respond to weather in a variety of ways. In terms of direct impacts from temperature, ozone is the most sensitive. But in terms of thinking about changes to wind pattern, both ozone and particulate matter play a role. This little chart is from a 2009 article by a colleague of mine at Harvard, Danielle Jacob, and a colleague at the EPA, Daryl Winner. But even though it was written in 2009, it was actually the subject of a New York Times article just last month. Cities' problems only get worse with climate change. Some work that actually I did with Don a number of years ago in support of the City of Chicago climate assessment was looking at these weather-ozone correlations, and we saw very clearly that more hot days led to more ozone, more sunny days led to more ozone, and days that had less wind led to more ozone. You can see this on a longer-term basis year to year, and in fact, this plot and some related work is coming out in an article coming out later this month that I'm co-authoring with Jonathan Patz and Howard Frumkin and other experts in health impacts of climate change, published in the Journal of the American Medical Association. I think that's due out on the 22nd. But basically, the years that have a lot of heat days also have a lot of bad ozone days. The good news is it's getting better. This is a particular ingredient to ozone, NO2, from space back in 2005 and 2010. The air over the US is getting cleaner, and one of the questions is climate change going to be undoing or setting us back some of these very expensive investments that we've made in the US for air quality? We spend about $50 billion a year. A last little note, I'll just say, when we're thinking about where is currently failing the standards that the EPA sets for for ozone and particulate matter. These are plots from the EPA, the little colored in regions or areas that are failing for each pollutant. And even though if you look at the map, it's not that many regions, these are actually the places that people live. So almost half of Americans are living in counties that are considered failing these EPA standards. And these standards are going to be in the news pretty soon too. The ozone standard up here is set currently at 75 parts per billion, but for about 10 years, the Science Advisory Council that advises the EPA has recommended that it be between 60 and 70. So in other words, right now it's more lenient than the scientific experts recommend. And really any day now, which could be any month or even a year from now, the EPA will be coming out with a revised set of ozone standards. And a lot of people are really hanging on the line to say, are they going to keep it at 75 or are they going to make it shorter? So that's all, and I look forward to questions during the panel. Thank you.